Radiation is very useful in medicine, especially diagnostic techniques. So we can use a radio tracer, which is a radioactive nuclide that's attached to a compound or introduced into a mixture, and this allows the doctor to track where that substance is going in the body. So it's a little bit like, attaching your Apple AirTag to something, and then you can see where it goes, right? So that's basically what a radio tracer is. They can be detected with great sensitivity, and they're identical in chemical behavior to non-reactive counterparts. So, you could take a molecule of glucose and exchange one of the carbon atoms or oxygen atoms for a radioactive version of that. And that molecule is going to behave the same, except that it's going to be decaying, right? And so then you can watch where it's going as it decays. One example is looking at your thyroid. So your thyroid gland naturally concentrates iodine. If you give iodine-131, a radioactive form of iodine, to a patient, it will accumulate in the thyroid. And then that can be detected very sensitively. And so you can look at the rate of iodine uptake, and you can image the thyroid gland without doing any surgery, right? Just by looking at that radioactive iodine. Different elements are taken up preferentially by different organs and tissues. So there's a lot of different radio tracers used to do a lot of different things. And this is just a summary. We can, image organs, bones, arteries, or we can locate infections or locate cancer. So, fluorine-18 is used in PET studies of the heart and brain. We talked about this one, iodine-131 for the thyroid. Phosphorus-32 can be used to find tumors. So this is looking at, this is an image of a patient who had, I believe it was technetium-99m, and then you can look where that goes in the body, and that basically is giving a bone scan of that person. So this is not an X-ray. This is looking at the radiation given off by TC99M. PET is positron-emitting tomography. So that's fluorine-18. You can attach that to metabolically active substances like glucose, and then the glucose in the blood will travel to the heart and to the brain. The positrons, as they are emitted, will combine with nearby electrons, because a positron is the antimatter of an electron. When a positron and an electron meet, they annihilate each other, and they send out two gamma rays in completely opposite directions. And so if you're monitoring where these gamma rays are coming, you can figure out where in the body that particle came from. So put a bunch of detectors, and they can find the origin. Very, very cool. So that's looking at detection or diagnosis. Radiation is also really good at killing cancer cells, because rapidly dividing cells like cancer cells are the most sensitive to this. The problem is, though, you shoot gamma rays into somebody's brain to get, the tumor, and it's also going to damage the healthy tissue that it goes through. So what they do is they take the gamma rays and they shoot them at you from many, many different angles. So they're always hitting the tumor but the healthy tissue only gets a little dose of the radiation. And so then you can kill a tumor, like a brain tumor. I mean, there's some brain tumors, you can't just go in there and cut them out with a knife, right? Because you need the parts of your brain that they have to cut through. So it's kind of tough. But you can use gamma rays, a gamma knife technique, and go in there and get at the tumor. This does have some side effects, definitely. You can get symptoms of radiation sickness, right? The nausea, vomiting, skin lesions, etc. And as we mentioned earlier, exposure to radiation increases cancer risk. Well, if you've got a therapeutic dose of 100 rems, and that increases your cancer risk by 1%, well, that's pretty acceptable if you already have cancer and your chance of dying from the cancer you have is 100%, right? So it's like, well, let's take a shot, right? Literally. Radiation can also be used to kill microorganisms. It can be used to sterilize medical devices. So before you implant like a pacemaker or something in someone, it needs to be sterile, right? Because you don't want to be implanting pathogens. Killing bacteria and parasites in food. Radiation is excellent at this. But people don't like it because it sounds bad, right? So these are strawberries that were irradiated, and those are strawberries that were not irradiated. Which ones do you want to eat? These don't glow in the dark. So the radiation will kill the microorganisms. It does nothing to the food. It's not going to alter its nutritional value. It's not going to cause it to become radioactive. And actually, pork is irradiated due to the real problem of trichinosis. So it used to be that you had to cook your pork until it was white in the center. It had to be well done. Or you could get trichinosis, lockjaw. It was really bad stuff. But by irradiating the pork, they can kill the trichinosis, and so now you can enjoy, medium rare pork chops. You can also use radioactivity to control insect populations. So, fruit flies are a big problem when you're growing fruit, right? So if you have a bunch of fruit flies that you sterilize and then you release them, they're going to go and mate with the other fruit flies, but they're not going to cause any new fruit flies to come, right? And so you can reduce the population of the next generation.
What we're trying to do with mosquitoes, in a way.
Well, yeah, there's work being done on mosquitoes. Yeah.
So does that mean like the food at Hiroshima, those there, would have lasted longer?
Would the food at Hiroshima have lasted longer? Well, some of it probably did. But eventually it's going to get more microorganisms on it.
And if it was really close, it burned us.
Yeah.
Yeah.